Imagine you're in your garden, spraying weed killer to protect your plants. You think you're just fighting weeds, but could you be harming yourself in the process? Glyphosate, a common ingredient in many weed killers like Roundup, is everywhere. It's in our gardens, on our farms, and even sometimes in our food. But over the past few decades, glyphosate has become a hot topic, sparking a fierce debate among scientists, health experts, and everyday people. Is it safe? Or could this seemingly helpful product be linked to serious health risks, like cancer? Section 1. What is glyphosate? Let's start with the basics. Glyphosate is a synthetic chemical herbicide, originally created by the Monsanto Company in 1974. This chemical works by targeting an enzyme that plants need to grow, essentially halting the growth and eventually killing them. It's highly effective, and that's why you'll find it in everything from commercial agriculture to backyard weed control. But here's the big question: what happens when humans are exposed to glyphosate? Does it pose risks? And if so, what kinds of risks are we talking about? Section 2. The glyphosate and cancer debate. The controversy around glyphosate largely revolves around one major concern: can it cause cancer? Some studies have linked glyphosate to an increased risk of certain cancers, such as non-Hodgkin's lymphoma, NHL, and its subtypes, including chronic lymphocytic leukemia, CLL. Let's break it down. A 2019 meta-analysis reviewed 6 human studies on glyphosate, examining the health impacts on nearly 65,000 people. The results were troubling. Individuals exposed to high levels of glyphosate had a 41% increased risk of developing non-Hodgkin's lymphoma. Another study in 2021 looked at similar cases but had mixed results. It found that while the risk for NHL was not significant across all cases, there was a possible link between glyphosate and specific subtypes of cancer, such as diffuse large B-cell lymphoma. But while these studies are compelling, they don't tell the whole story. The research isn't always consistent, and different studies have shown varying results. Some experts argue that while these studies suggest a connection, they don't prove that glyphosate causes cancer. In fact, the U.S. Environmental Protection Agency, EPA, has stated that glyphosate poses no risk to human health if it's used correctly. Section 3. Glyphosate and your health. More than just cancer. Aside from cancer risks, some research points to other potential health effects of glyphosate. These effects might not always be as serious as cancer, but they can still impact your well-being. For example, hormonal disruption. Glyphosate has been linked to endocrine disruption, meaning it could interfere with the body's hormone systems. Thyroid function. Some studies have found that exposure to glyphosate can alter thyroid function, which plays a crucial role in regulating metabolism and energy. Reproductive health. There are indications that glyphosate could affect both male and female reproductive systems. Liver health and gut microbiome. Glyphosate might also play a role in non-alcoholic fatty liver disease and alter the gut microbiome, which is critical for digestion and immune function. So while the cancer debate continues, it's important to understand that glyphosate might carry other health risks that we're still uncovering. Section 4. Risk factors for cancer and CLL. Non-Hodgkin's lymphoma, including its subtype CLL, doesn't always present symptoms right away. Many people discover they have CLL during routine checkups or blood tests. But if you do experience symptoms, they may include fatigue, night sweats, swollen lymph nodes, unexplained weight loss, fever, and chills. These symptoms can be caused by many conditions, so don't panic. If you're concerned about your exposure to glyphosate and have any of these symptoms, it's always a good idea to consult with your healthcare provider. Other risk factors for CLL include being over 50, having a family history of the disease, and being male. If any of these risk factors apply to you, it's worth having a discussion with your doctor about your potential risk. Section 5. Using glyphosate safely in your garden. If you use glyphosate-based weed killers, it's important to be mindful of safety. Here are some top tips from the National Pesticide Information Center. 1. Follow label instructions. Always read and follow the product instructions carefully. Misuse can increase your risk of exposure. 2. Remove surplus items. Before you start spraying, remove any pet bowls, toys, or other items from the area. 3. Shield sensitive areas. Cover plants and areas that don't need treatment, like vegetable gardens and play areas. 4. Avoid windy days. Spraying on a windy day increases the chance of drift, meaning the spray could end up on you or unintended areas. 5. Stay away until dry. Keep people and pets out of the treated area until the product has completely dried. Taking these precautions can minimize your exposure and reduce the potential risks associated with glyphosate. Section 6. Alternatives to glyphosate. If you're worried about using glyphosate, there are alternatives. Some people opt for natural or non-toxic herbicides, like vinegar solutions, that can help control weeds without synthetic chemicals. Others turn to physical methods, like mulching, hand pulling, or using a hoe. The right method for you will depend on the area you're treating and the type of weeds you're dealing with. Remember, it's always worth researching and considering all of your options. Conclusion: what's the verdict on glyphosate? The reality is that the debate around glyphosate is complex. There's no clear answer yet, and research on the potential health risks is ongoing. While some studies suggest a link between glyphosate and cancer, others have found no conclusive proof. However, whether or not you're convinced of glyphosate's risks, it's essential to be mindful of your exposure. If you're using glyphosate, take precautions and use it as instructed. And if you're unsure about its safety, consider alternative methods for weed control. Ultimately, the decision to use glyphosate or avoid it is up to you, but staying informed about potential risks is a powerful first step. In summary, whether you're a home gardener or a concerned consumer, it's crucial to weigh the risks, stay updated on new research, and make choices that best align with your health and environmental priorities.
You